Welcome to today's video where we'll be exploring Kuru, a rare and fascinating neurological disease. Once prevalent in a specific region of Papua New Guinea, Kuru offers a stark lesson about the dangers of unconventional practices and the resilience of the human body. Join us as we delve into the history, science, and impact of this unique ailment. Kuru's etiology is deeply rooted in a now discontinued practice of ritualistic cannibalism among the Fore people of Papua New Guinea. Specifically, it was the consumption of deceased relatives' brains that transmitted the infectious agent. This agent isn't a bacteria or a virus, but a prion, a misfolded protein that causes other proteins to misfold as well. This practice, known as endocannibalism, was done as a sign of respect and mourning, believing it helped to keep the spirit of the deceased alive within the community. At a cellular level, Kuru is devastating. Prions, specifically the abnormal prion protein PRPC, enter the body and convert normal prion proteins of PRPC into the abnormal, infectious form. These misfolded proteins accumulate in the brain, forming plaques and causing widespread neuronal damage. This damage is particularly pronounced in the cerebellum, the region responsible for coordination and balance. The characteristic spongiform appearance of the brain riddled with holes is a hallmark of prion diseases like Kuru, giving them the name transmissible spongiform encephalopathies. Epidemiologically, Kuru was almost exclusively confined to the Fore linguistic group and their neighboring populations in the Eastern Highlands province of Papua New Guinea. The prevalence peaked in the 1950s and 1960s, primarily affecting women and children, who were more often involved in the handling and consumption of brain tissue. After the practice of endocannibalism was outlawed in the mid-1950s, the incidence of Kuru dramatically declined, demonstrating a clear link between the practice and the disease. The signs and symptoms of Kuru manifest in distinct stages. Initially, individuals may experience subtle changes like headaches, joint pain, and loss of coordination, known as the ambulant stage. As the disease progresses to the sedentary stage, severe tremors, loss of muscle control, and difficulty speaking become prominent. Eventually, the terminal stage is reached, characterized by the inability to sit up, severe dementia, and eventually death. A unique symptom, from which the disease gets its name, is shivering or trembling, which the Fore people described as Kuru, meaning to shake. Diagnosing Kuru can be challenging, particularly in the early stages, as the symptoms can mimic other neurological disorders. Diagnosis primarily relies on a combination of clinical presentation, patient history, and, in the past, brain autopsies. The distinctive spongiform changes in the brain tissue, along with the presence of prion plaques, are definitive diagnostic markers. Modern diagnostic techniques may involve advanced brain imaging, although these are primarily used to rule out other conditions. Genetic testing can also be used to rule out genetic forms of prion disease. Kuru is not typically classified into different subtypes. It is considered a single, unique prion disease directly linked to the specific mode of transmission through endocannibalism. Unfortunately, there is currently no cure or effective treatment for Kuru. Management focuses on providing supportive care to alleviate symptoms and improve the patient's quality of life. This includes managing pain, preventing infections, and providing nutritional support. The disease is invariably fatal. The key to preventing Kuru was the cessation of endocannibalism. Following the outlawing of this practice and subsequent public health campaigns, the incidence of Kuru has dramatically decreased. Continued monitoring and vigilance are essential to ensure that such practices do not resurface, and that other potential routes of prion transmission are addressed. The prognosis for Kuru is uniformly poor. It is a fatal neurodegenerative disease. Once symptoms appear, the disease progresses relentlessly, typically leading to death within a few months to 2 years. Recent research has focused on understanding the mechanisms of prion propagation and developing potential therapeutic targets. While a cure remains elusive, scientists continue to explore innovative approaches to combat prion diseases, not only for Kuru but also for other, more common prion diseases like Creutzfeldt-Jakob disease.